Let me ask you a question. Think about diabetes and how it's affecting a human body. What do you think of when you're thinking about the disease? I'm Bastiaan Franssen, I'm 28 years old, and I have been a type 1 diabetes patient for pretty much all my life. And today I'm going to share some information with you about the disease. There are two types of diabetes, two general types of diabetes, type 1 and type 2. Type 1 is an autoimmune disease, which means that the body attacks its own cells. This results in complete insulin dependency. Type 2 diabetes is a diabetes that occurs after having insufficient exercise or a bad nutrition plan, but it could also be inheritable from your parents or from your family. More and more younger people these days are being diagnosed with type 2 diabetes. This is also as a result of lack in exercising and lack in proper nutrition. At the moment, there are 385 million people worldwide suffering from diabetes. And in the upcoming 25 years, it's estimated that there is going to be 250 million extra people being diagnosed with diabetes. 95% of these people are being diagnosed with type 2 diabetes. Only 5% of them are being diagnosed with type 1. When we're talking about the disease, we're oftentimes talking about type 2 diabetes. But type 1 diabetes is more intrusive on the life of a patient. Type 1 diabetes is a disease that actually affects all parts of a human body. It affects your mental state, but it also affects your physical state as well. Complications such as retinopathy, which is damages to your eyes, neuropathy, which is damages to your nervous system, and nephropathy, damages to your kidneys, are quite often with type 1 diabetes patients. Medication and education is one of the parts that are necessary for type 1 diabetes patient to have a decent lifestyle. But not only that. If you want to follow me and the struggles that I'm having with my diabetes, be sure that you follow this channel.